All right. So again, welcome so much everyone to learning series, our third learning series of the SEAC, promoting attendance early, absenteeism in kindergarten and the early grades. Today, we're really excited to jump into our panel conversation in which we'll be putting strategies in conversation with each other with a couple of special panelists from across federal, state, and local level stakeholders. Before we get started with that, though, we wanted to introduce some of the people who make the SEAC team possible. My name is Taniko Reed, and today I'm joined by my colleague, Tori Martin, and the two of us have coordinated the starting theories. We also would like to thank the Department of Education staff, including Dr. Tracy Scott, Brian Cohane, and Liz Lembo, who give us the resources in order to make this series and others possible, as well as the joint leadership of Dr. Jarrell Crocker and Sarah Frizzell, of the Student Engagement and Attendance Center. In addition, we would like to thank all of our panelists today, as well as our moderators for joining this session. We'll have extra bios for them in just a few moments. So you've seen these objectives before, and we'll see them one more time today. Really, the goal of this series overall, though, is to explore the reasons behind kindergarten chronic absence in the early grades, really focusing on that kindergarten grade specifically, that early entrance to school, but also acknowledging the pre-K through third grade context. The goal of this series is to explore chronic absenteeism and support attendance for early grade students, kindergarten in particular, while also understanding the varied needs of different specific and higher needs student populations. On our first session, we covered the why behind kindergarten, and our last session, last week, we used tools like root cause analysis in order to talk about equitable considerations for kindergarteners and chronic absence. And today, we really wanted to focus on strategies, and equitable next steps that you can take in order to do more to support your students for preparing for kindergarten schools that are starting in the fall. All right, so a couple of key themes that have emerged throughout this series. We've really realized that kindergarten is a key inflection point for early learning, for early school success, and for equity across the board. As we've learned in many states, kindergarten chronic absence remained higher than other grades, particularly after the onset of COVID-19 in 2020. We as a SEAC really feel that kindergarten presents an important opportunity for parents and families to liaison with educators to build the relationships, routines, and habits that are essential to early school success and everyday school excellence. And so that's why today we wanted to examine some of the promising practices used to strengthen kindergarten chronic absence and develop next steps to apply system-level strategies to strengthen kindergarten attendance across the board. All right, so after that long introduction to give us some extra context about why we're here today, we really want to focus on our panel today and all of the panelists that we have joining us. We have four amazing panelists here to share their experiences, and we're also welcomed today by Swati Adhikar, our moderator for this session today. So first, I'll start out with some brief bios and introductions for each of them, and then I'll turn it over to Swati to begin asking questions of our panelists and talking about each of the people who are joining us today. To give you some extra context as to who these people are, we'll start with Swati. Prior to her role as the Deputy Assistant Secretary for Policy and Early Learning in the Office of Elementary and Secondary Education, Swati Adhikar has served as the National Policy Director for Start Early. She has also served on statewide advisory committees for early childhood for 3 Oregon governors and provided the vision and leadership to launch and sustain the Early Works Initiative, which aligns birth to 5 services and supports elementary school. For more than 30 years, she has been a strong advocate for meeting the comprehensive needs of low-income children and families in Oregon and California, and she has a passion for ensuring the health and early school success of our young children. Swati is today's moderator for this session, and we are so glad to be joined by such expertise and excellence. Thank you so much, Swati. Moving on to our panelists today, first we'll start with Kathleen Holmes. Kathleen joins us as a senior public health analyst in the Chief Medical Office and the Immunization Services Division of the Centers of Disease Control and Prevention. She coordinates Let's Rise, the routine immunizations on schedule for everyone program, which is the division's initiative to understand and address pandemic-related declines in routine vaccinations. Thank you, Kathleen, for joining us and for providing our CDC perspective today. Next, we would like to introduce Yoli Flores. Yoli Flores is the president and CEO of Families in Schools, a capacity-building leadership and advocacy organization working to ensure that families are involved and engaged at every level of educational change and giving opportunity for their children. Centering the voices of families who have been historically marginalized by the education system, two key FIS advocacy initiatives include the Read LA campaign, which elevates the importance of early literacy, and the FIS Parent Ambassadors Leadership Campaign, which equips parents with advocacy skills focused on closing equity gaps in schools. To give that important equity perspective and also center the importance of family engagement, thank you so much for joining us today, Yoli. All right, next we have Lori Masur. As Director of Early Learning, Lori Masur guides Read On Arizona's collaborative work in several strategic priorities, including data integration, expanding effective literacy practices, and building educator capacity for these early learning professionals. These strategic priorities are targeted at improving school readiness, early literacy, and system buildings efforts in the state of Arizona. Lori also facilitates the state's chronic absenteeism task force. We're really excited to hear about your data perspectives and your literacy practices, Lori. Thank you so much for joining us today. And our last panelist for today, Catherine Piers. Catherine Piers is a program director and the developer of Kids in Transition to Schools, also known as KITS, and our work centered around supporting families and early childhood and K-12 educators to help children have positive transitions to elementary school and to subsequent positive experience in schools. Catherine is the developer of the KITS program, an evidence-based, strength-building approach focused on creating equitable, caring environment for gaining school readiness skills. KITS is a really successful program, and we're so excited to hear from you, Catherine. Thank you so much for joining us today. All right. So without further ado, we don't want to spend so much time just introducing these people. We actually want to talk to them. So at this point, I'll turn it over to Swati to begin asking some questions of our panelists. Right before I do that, though, I do want to encourage, as you hear from our panelists today, please add your questions to the Q&A box at the bottom of your screen. We'll have a huge portion of today's discussion focused specifically from hearing from you. So Swati, please take it away.
Thank you so much, Taniko, and for that wonderful, warm introduction. It's such a pleasure to be with this amazing group of leaders who are all able to help us think more about how to help kindergartners and early grade students get to school every day on time. And so we'll start with you, Kathleen. For the last few years, we've been all focused on addressing the impacts of COVID-19. And just making sure that kids and everyone get vaccinated. How has the pandemic impacted regular early childhood vaccines, and what are the implications specifically for kindergarten attendance?
Thanks, Swati, for this question. And before I start, it's a pleasure to be here with you all today and a part of this important discussion. So unfortunately, routine childhood vaccinations took a hit during the pandemic. Vaccination coverage fell by 5% among young children living in poverty and in rural areas. And kindergarten vaccination coverage fell to the lowest coverage level that we've seen in decades, declining from 95 to 93% nationally, but dropping by as much as 10% in some states. And the expected rebound in kindergarten vaccination coverage has not yet occurred, even after nearly all schools returned to in-person learning and healthcare services such as annual checkups began to normalize. While 93% coverage may sound great, In order to prevent vaccine-preventable disease outbreaks, vaccination coverage levels must actually be very high, above 95%. So even small drops in vaccination coverage put children at greater risk for illness, as evidenced by a 30-fold increase in measles cases in Europe last year after coverage dropped there by just 1 to 3%. So we estimate that there is about a total of 725,000 early learners that entered kindergarten during the pandemic who were not up to date on their vaccines and are potentially susceptible to vaccine-preventable diseases. And just to note that drops in vaccination coverage also put under-vaccinated communities and schools at risk for exponentially larger disease outbreaks, including not just measles, but mumps, flu, COVID, whooping cough, and chickenpox, the impacts of which extend well beyond health and safety. It also impacts student absenteeism and, in turn, learning. So while we know that kindergarten readiness is multifactorial, we believe that vaccinations are one tool that can help keep kids healthy in school and ready to learn.
Kathleen, that's really important information and, quite frankly, pretty jaw-dropping in terms of the extent. Could you talk a little bit about what are the most impactful ways to ensure kids get up-to-date vaccinations so we don't keep seeing that trend go downward but can make real progress?
Sure. So we really see education professionals and early care and education providers as key partners in this effort to get kids caught up on their routine immunizations. You're trusted leaders within your communities, and as such, you have the unique ability and opportunity to carry health messages and support families to ensure that they're up to date on their well visits, including vaccination. So some of the impactful ways that we really think schools can work in partnership with healthcare providers and public health professionals to encourage routine vaccination include amplifying immunization messages and reminding families about school vaccination requirements, helping share the facts about vaccines, including that they're safe, expanding access to immunization services for students through referrals to Vaccine for Children providers, or by hosting a school-located vaccination clinic in partnership with local health department, local providers, or pharmacies, sharing and utilizing data for action. And we also really think that school nurses can play an important role in identifying and notifying families whose children are behind on immunizations, and support families to have health insurance, including support with Medicaid enrollment. So our program, we work at the national level at CDC, and Let's Rise, we do have a webpage with resources and data for partners to use, including calls to action and a toolkit for schools and early care and education providers. And our goal with these resources is really to engage and equip partners to be vaccine champions, recognizing that schools also have staffing shortages and an incredible amount of work that you're undertaking to also catch up from pandemic-related impacts. So wanting to make it as easy as possible for you to take these materials that are actionable and be able to use them for your communities.
Thank you, Kathleen. Those are really helpful resources and strategies to help address that issue. I'd love to have you join this conversation, Yoli. You bring so much experience around this work you're doing on literacy and engaging families deeply in this work. And we know that literacy is a state priority across the country. And it's urgent that we address the inequities in literacy outcomes for all students, including English learners, students with disabilities, and those from families with low incomes, as has been documented in the most recent National Assessment of Educational Progress. Can you talk about the connections that you see between kindergarten early grade attendance and elementary literacy instruction and outcomes?
Sure. Thank you, Swati. And I will echo Kathleen's Gratitude for being here with all of you today, and just the honor that it is to be on this panel and to speak about these critical issues. So, Swati, I think that the nation is finally recognizing just how critical it is for us to solve the early literacy crisis in this country. And it exists everywhere across the nation. I'm in California, obviously very focused on our state here and in LA. And 70% of low-income children in California are not at grade level by the end of third grade. And we know it starts early. Learning to read actually starts at birth. But the actual instruction, the explicit systemic instruction of learning to read begins in kindergarten. And so if our kids are missing a lot of school in kindergarten, which is generally where the highest peak of chronic absence is, it's generally in kindergarten and in ninth grade, then we know that kids are already missing out on the foundational skills of early literacy. Our data in California, but it's similar across the country, showed a huge learning loss. 17 million students have more than half a year of learning delay. And that starts with looking at third grade reading proficiency. So it is so essential that we begin to focus in earnest in this nation of how we're going to solve the literacy crisis. As I like to say, actually, I don't like to say it, but if you can't read, it's practically game over for so many children. Because we know that the impact of not reading has such detrimental, it's not just that they're less likely to graduate from college, but we know if we look at the incarceration system, the majority of people that have been incarcerated can't read. And it's such a solvable problem. So, and it starts early, it starts in kinder, which is why really conveying the importance of attendance in those early grades and really pushing on the right instruction so we know how to teach children to read cannot be more important and essential for us to address.
Yoli, thanks for providing that really important context about why this issue is so important and why we should all care about this issue starting from the earliest years. How does engaging families in kindergarten and the early grades impact children's attendance? And how does this engagement affect the reading proficiency that you've underscored is so important in the kindergarten year?
I love that question, Swati. And because it's, we have such a clear answer. And the clear answer is that we have over 50 years of research in our country that engaging families deeply, authentically, as equal partners is a key strategy for student success. We know that when families feel welcomed, when they have the tools, the knowledge, the information, nobody wants their children to succeed more than their families, more than their parents. In work that we have been doing, focus groups and other ways that we bring families together, families are saying to us that they know reading is important, but they don't know necessarily how to help their children. And so really it's up to us to engage with families, bring them along, see them as partners, provide them the tools that they need to support their kids while they're doing the learning in school. Swati, I think you might know about this, but we have been rolling out community sessions across Los Angeles on early literacy. And it's been so inspiring, not surprising to me, but so inspiring to see the number of families that are coming to learn. They are hungry to learn. They're learning about the science of reading. They're learning about brain science. And oftentimes we think that that's just too much for families. And we underplay that families can absorb information. They can learn just as well as children, and all of us can learn. And that knowledge is power. And these sessions keep growing. I just came from one this morning where families are learning about early literacy, about the importance of being in school every day, daily attendance, and the impact that has on early literacy. So we can do this. We have ways and strategies, and we've talked about that a little bit more in this session of how to engage families authentically so that all our kids are on grade level for reading.
Yoli, that was so inspiring and such a great way to concretize the way that you're centering not only just young readers, but the engagement of their parents, families, and communities. Thank you. I'd love to invite Lori now into this conversation as we continue our focus on literacy. Read on Arizona serves as the state's early literacy collective impact model initiative that has a strategic focus on school readiness and third grade reading proficiency. Over the last decade, Read on Arizona has done many things to address literacy gaps in students across the state, particularly for those in communities with low incomes. Lori, how do you address this barrier to early school success? And who are some of the key partners you work with to support everyday school attendance?
Absolutely. Thank you, Swati. And I think it's integral and important for us to point out that how we address these barriers to early school success is really baked into the tenets and the design and structure of Read on Arizona. So Read on Arizona is a public-private partnership, and it includes state agencies such as the governor's office, the Department of Ed, the State Board of Education, along with philanthropic partners and community leaders and local literacy stakeholders who are all committed to taking a very collaborative, data-driven approach to addressing factors that we know are impacting school readiness and early literacy. One of those factors being regular attendance. And so it really is about how are we all in the same boat, rowing in the same direction toward the same goals, right? And so this approach really allows Read On and the partners in Read On the ability to determine where are the gaps? Where are the communities that are experiencing lower levels of reading proficiency, and simultaneously we're seeing those upticks in chronic absence, and not only from a geographic perspective, but from the perspective of are there certain subgroups, are there certain populations that we need to target? And then once we determine where those gaps exist, how do we collectively and collaboratively identify solutions and then implement a collaborative approach to addressing early literacy and simultaneously addressing those attendance challenges? Like many states, we saw our proficiency levels decrease as a result of the pandemic and chronic absence rates increase. And so partners in Read On Arizona in 2020 identified 4 shared strategic priorities that they felt would help accelerate early literacy. And that was around how are we building educator capacity in the science of reading that Yoli mentioned, how are we scaling up evidence-based solutions that we know work? And that's where we focus our efforts around improving attendance and decreasing chronic absence. How are we engaging families and communities and expanding access to quality early learning? And that happens not just at the state level. There's also a network of what we refer to as Read On communities that are spread throughout the state. And each of those Read On communities also works with an array of local stakeholders. They're local school districts, they're local policy and decision makers, and they apply those same 4 strategic strategies that we identify at the state level to the local level as well. And I'll piggyback on what Yoli said. We know that learning to read is a culmination of skills that build upon each other and build over time. And if children are not regularly attending, they're missing critical instructional time, and they're also missing those building blocks to becoming proficient readers. I'll point to a study that Read On Arizona did a number of years ago with a local university that demonstrated the connection between attendance rates and proficiency outcomes. And that data analysis showed that a 1% increase in school level attendance was associated with a 1.5% increase in students passing the state's third grade reading assessment. And this really served as really an impetus and catalyst to us saying we have to address children attending on a regular basis if we're going to curtail and begin to see that uptick in improvement in reading proficiency levels, and honoring that kindergarten and first grade are key instructional windows and opportunities that we need to be, to Yoli's point, explicitly and systematically teaching those reading skills. And so recently, the past year and a half, we have begun to convene a chronic absence task force that has those state agencies, policy leaders, and school leaders at the table to begin to identify what are those targeted supports and key recommendations that we can provide to support the field on effective policies and best practices for reducing chronic absence.
Lori, thank you so much. From that wide lens of all the stakeholders and partners that it takes to have this key mobilization, to really helping us drill down on what the specifics are and why attendance is so important in kindergarten and the early grades. Now, share with us the impacts around data and data sharing systems and how that is driving programmatic decisions. And you kind of hinted at that as you were delving into your strategies, but we'd really love to hear more about that.
Absolutely. We say at Read On Arizona that data is the engine that drives the work that we do, right? In 2015, Read On Arizona partnered with Maricopa Association of Governments, which is our local regional planning agency. And along with input from state partners, we created a population level integrated data system that combines data from a wide range of state agencies and programs that are serving children, they're serving young adults, and they're serving families. And that particular tool is what we refer to as Maplet. And so Maplet really serves as a clearinghouse for census data, school data, early learning data, health and community data, data points that we associate with factors that we say impact school readiness and early literacy. And so Maplet allows end users, when I say end user, that's state leadership, that's school district leadership, that's families, that's schools. And it allows that end user to process data from that big picture down to focalizing on specifics, such as region-specific literacy data, looking at their chronic absence rates, looking at enrollment data, looking at gaps in early learning data. And what it really allows them to do at those varying geographies is to identify communities that we say have a high need, such as low-income communities, and they have low services or low amount of resources. And it allows you to look at that data not only for that current point in time, but it allows you to look at that trend data over time. And the beauty of those shared data systems is that partners, that school districts, that community leaders are able to take that information and share that information with partners and with decision makers to inform strategic planning for those innovative solutions. What does it look like to think about, do we bring instructional coaches to a particular area? What are those effective strategies to tackle chronic absence? Is it a messaging campaign? How do we help school district leadership identify early interventions that are aligned to the root cause behind why children are absent? And then how do they identify those gaps and inform those next steps? So really helping them to go from big picture to focalizing on those specifics and really thinking about the relationship between those data pieces and how they're impacting early literacy and how they're impacting school readiness.
Thank you. That really gives us some concrete, specific ways to think about how you can drive with data. Really appreciate it. Let's invite Catherine to this conversation now. And Catherine, Kids in Transition to School, or KITS, has years of solid research on the impact of implementing programming to ensure successful kindergarten transitions in several districts across Oregon, engaging both kindergarten teachers and parents. Can you talk about the impact KITS has had on everyday attendance? How can other states and districts replicate efforts like KITS in their own communities?
Sorry, remember to unmute oneself. Thank you for the question. And again, I'm going to echo my fellow panelists and thanking all of you for inviting me here today. So thinking about KITS and the impact on everyday attendance, I think when we talk about attendance, or at KITS, when we talk about attendance, we're really talking about two things. We're talking about not only whether kids are physically in the classroom, but also how they show up to the classroom. So when they're physically present, are they actually attending in a way that allows them to learn and benefit from the classroom instruction and from social interactions? So we talk about school readiness and are they ready to accept that learning? So really in KITS, what we're aiming to do is see improvement or a solid foundation for the way that kids show up to school. Do they have the early literacy skills that are foundational to reading? Can they attend to the lessons? Can they regulate their own feelings and behaviors so that they're not, if their friends ask them to play, that they know how to do that? And in those ways, allow children to walk into the kindergarten classroom better able to focus, better able to get along with the community of their peers, and to really benefit from the time that they're in the classroom. So if they feel successful, they're going to want to come to school. And the way we do that is to have a summer program in which we involve both the children and their families and teachers from the schools. So we have the children in school readiness groups in which they are really practicing those skills that they're going to need in kindergarten, both at the academic level and also at the social emotional level. And data from our clinical trials of doing kits for a number of years show that kits really does positively affect both the early literacy and the social emotional skills at kindergarten entry, and that leads, that's sort of the conduit through which kids, we have positive effects on academics in third grade, and indeed on mental health, as these children, we've now been able to follow one group of kids through their early adulthood, and that we're showing positive effects on mental health in early adulthood for kids who were in the kids program before kindergarten. So, really working on those foundational skills and making and helping that bridge that they're having into kindergarten be really sturdy for the children. Also, as a number of my fellow panelists have noted, family engagement's key. Absolutely key to children's ability to do well in school, and particularly to attend school. Because when they're this small, they're not driving themselves to school. They need their parents. Their parents are the ones who are helping them get up in the mornings and helping children get to school. So KITS also has a group for parents where we really work with them to support their children's active school attendance by doing things like creating routines so that they can get out of bed in the morning and get off to school and really get the best start of their days. We also talk with parents about drop off, because one of the things that we found is that when children don't have experience, say in preschool or prior or pre-K prior to kindergarten, that can be really intensely anxiety provoking, both for the kids and for the parents. And so we've had parents who've come in with children who don't want to stay in the classroom. I mean, they're running out of the classroom. And by having that experience before, in a smaller group in KITS, before they're being asked to go into a larger classroom, we really can get kids and parents used to, okay, this is where you go. School is safe. This is a space that, you're going to enjoy. It's going to be fun. And you know how to do what you need to do to be successful. So really working with parents about routines, about the importance of school, and also about how to get involved in school so that they feel engaged. And making sure that parents, while they're in the program, they have access to these materials. And then we have a blog that we use to really give access to parents after they're finished the program, both in English and Spanish, with lots of resources about a range of topics. And then with educators, I think you asked me, how could other states and districts replicate KITS in their own communities? And we have successfully replicated KITS, as you mentioned, in a number of districts in Oregon. We're also now in North Carolina, and this year we're going to be moving to Montana. So we've been able to get mobile across the country. And I think there are a few things that when people think about how to replicate good school readiness in their communities that are really important. The first is really to understand, and I've heard it echoed, and I know I've said it, but that kindergarten is really this bridge. This is the all-important point. I mean, it's not the only point, but it is extremely important in terms of what we know about how kids succeed or not in school in the future. So really making sure that kids are ready to enter kindergarten and that all kids have equitable access to that readiness is really important. And then I think recognizing also the huge value of social emotional skills. In addition, I mean, literacy is huge. It's absolutely correct. That's really important. And to get to literacy, kids need to be able to focus and they need to be able to get along in that community of the classroom. And I think what we have found over time is that teachers don't necessarily, they get the training on how to teach children to read, but they don't receive training on how to help build children's social emotional skills. And we're hearing, I mean, since COVID, we are hearing more and more about really big behaviors in the kindergarten classroom and suspension and expulsions of kindergartners. So it's clear that teachers really need to understand how to help kids develop these really important foundational social emotional skills. And in KITS, we have a very large focus on training the teachers as well as working with the families, so that we're really bringing the teachers and families together in the sense of helping them with the same sorts of strategies to teach children at home with the social emotional skills and the teachers in the classroom, so that there's really that continuity. And I think that again, talking about this bridge, we really need continuity between home and then the final piece, or one of the final pieces, not the final piece, is really making sure when we're working with families and children that we tailor the programs to fit the families and don't expect the families to fit into our program. So, knowing that not all families can afford that pre-K all year, attendance is why it's important for kids to happen in the summer, or to have something in the summer prior to kindergarten to really get kids prepared. And then that needs to be free to parents. And you need to consider things like providing transportation to parents and children, and to really doing it at times that the parents are available, and to really ensuring, again, from an equity standpoint, that those materials are available in parents' primary languages, the translation is available, that we're really able to include all the families in these kinds of programs. And that's going to set their solid and sturdy bridge.
Catherine, you've painted such a vivid picture of the multiple components that are needed to create that smooth on-ramp. And did I hear you say that the training and supports go beyond just the beginning of kindergarten entry? I'm curious about that, because most transition efforts conclude at the beginning of the kindergarten year. I'd just love you to clarify that.
We have several ways in which we do KITS. There are districts we've designed it so that it can happen in the summer before school, or there can be a piece that continues into the school year, because, parents don't lose the need for support when they get to the school year. And so with districts that want to do that, we definitely have the way to carry over the parent groups into the school year, so that they can continue to get together, and that we can sort of troubleshoot if they have a relationship with us, they know us, and if things do arise, we can do a soft handoff into the kindergarten classroom from our program. We also, as I said before, we have a great number of resources on our website that we really encourage parents to look at. And they're all free and open to the public, so that parents always have that resource. Yes, but blockending or bookending that transition, rather than thinking of it as just once they're in the kindergarten classroom, they're there, is something that we try to figure out how to make it a softer landing for children.
Thanks so much, Catherine. Really appreciate it. Would love to have a chance to bring Yoli and Lori back into the conversation to talk about the key strategies you're using to address attendance and effective literacy. I don't know which of you would like to chime in on that, and we have time for both of you to answer if you'd like to.
I'll chime in, Lori, if that's okay. So I wanted to share that the numbers of kindergarten students in California that are chronically absent, like in most places, have just exploded. And I am partnering with Attendance Works and another organization, PK, so Families in Schools, Attendance Works, and PK came together in part 2 of a partnership that we started during the pandemic to begin to think about the strategies for addressing that huge increase in chronic absences. It was already large. It's grown, as you all know. And one of the things that we were very clear about in terms of an important strategy, Swati, is that we had to not assume we knew the answer of why there are so many more children chronically absent. In California, obviously, the numbers of Latino kindergartners is the largest concentration of students. And so we've been conducting a series of focus groups across California, Northern California, Central California, and in Los Angeles to really learn from families what are the barriers and the obstacles not from a blaming or judging, but really just wanting to know. So before you jump into the strategy that you think is the right strategy, we think it's so important to listen to the voices of families. And we haven't concluded the focus groups, but they're giving us the answers to those strategies. Some of them we've already talked about. There's a lot of issues still around social and emotional trauma from leftover from COVID. There's transportation issues. Students, this is mostly in the older grades, who feel they're so far behind that, why go to school? But the other thing we're learning is something that I think we've sort of touched on, and I think we need to spend much more time on, and that's clarifying for families that kindergarten is a learning space. Oftentimes, many families still think it's, just playing. Kids are just coming to play and socialize, and obviously play and social engagement is critical in the early years, but there's also learning that's happening, and the foundation for reading is happening. But our families do not know that. So that's an important strategy to bring in, is that knowledge building and information. The last thing I'll say, and I'll turn it over to Lori, is that families need more clarity about what constitutes staying home if your child is sick. There's a lot of contradictory information. One school will say one thing, another school will say another thing about whether you've got the sniffles, is it okay to stay home or not stay home? And that families are saying that it needs to be a more frequent conversation, not just a one-time conversation. So those are some of the things that, we're learning as we try to address the chronic absence issue in California for kindergartners.
Thank you, Elaine. And I'm sorry. I'll just piggyback on that to not be duplicative, because I think there are many things that Arizona is doing that look very similar to what's happening in the California space in terms of conferring with national experts at Attendance Works around how do we support our education leaders, our families, and really supporting them to Yoli's point about how are we, identifying the intervention that matches the reason for why a student is absent. But also simultaneously, I think we have to build capacity around our state about what chronic absence is. For many, school leaders or governing boards and others, they still are confusing that with truancy or average daily attendance. So how are we clarifying what those terms are so that we can begin to make inroads in terms of improving attendance rates and reducing chronic absence? One of the strategies that we are engaging in partnership with Attendance Works is beginning to train a critical mass of our school districts and classified staff, their attendance teams and others on what is chronic absence? How do we begin to use data to identify those populations who are chronically absent? And not only how do we use that data to begin to identify, but how do we use that data to select the appropriate intervention moving forward? And that's what's happening in the chronic absence space. I've seen some of the pieces in the chat about the importance of literacy instruction that's happening, in the K-1 space. And, part of that is how do we train a critical mass of our teachers about what does effective literacy instruction look like, and not making assumptions, not saying that they don't know what they're doing, but how are we effectively building their capacity in that space? Learning to read is something that's a culmination of skills that happens over time. Children don't magically show up in third grade just because there's a third grade reading proficiency test and now they've suddenly learned, consonant blends and and learning to read words that have irregular spelling patterns, right? We set those pieces up in kindergarten and first grade when we're asking them to manipulate phonemes and we're asking them to segment and blend words, and all of those things lay those foundational pieces. How do we talk about what does explicit and systematic instruction look like? And I'm going to say, even in the preschool space with some of those phonological awareness pieces, what does it look like in that space? What does it look like in kindergarten, first grade, and second grade? Because it's a culmination of those skills prior to them getting in third grade, and really stressing the importance of what research says is those critical windows of time for literacy to be taking place. And so really sort of paying attention to those spaces and making sure that we're building capacity, not just of third grade teachers, but also of those pre-K, K, first and second grade teachers as well.
You both did such a great job of underscoring how young children aren't going to get to school and stay in school without the adults in their lives really supporting this with meaningful two-way engagement with parents and families and professional development for kindergarten and early grade teachers. That's really helpful. I'd like to ask a question to any of you who want to answer this, and let's see if we can bring in our other couple panelists on this too. There was a question from the audience around how you're bringing an equity lens to this work. We know from this series that SEAC has been hosting that not all populations of kids are equally being affected by this issue of chronic absence. We're seeing disparities. Can you speak to, and I'd like to start with Kathleen around vaccines and how we tackle that, knowing that there's different issues out there for different communities and groups. If you could come back to the conversation.
Sure. Yeah, that's a great, fantastic question. So in regards to health equity, CDC administers the Vaccine for Children's Immunization Program. And this is a federally funded program that provides vaccines at no cost to children who might not otherwise be vaccinated because of their inability to pay. So we buy vaccines at a discounted rate and distribute them to state health departments and certain local and territorial public health agencies. And then these groups in turn distribute them to private physicians' offices and public health clinics that have registered Vaccine for Children providers. And so this is really our way of being able to make sure that anyone, regardless of insurance status or ability to pay, is able to get vaccinations. And through this program, we administer about 40 million vaccines to uninsured children across the US annually, which is about 50% of children receive some sort of vaccine through this program.
Thanks so much, Kathleen. Let's think about English learners in this conversation. Yoli, could you address that?
Yes, I would love to. California has a significant population of English learners. 25% of students in kinder to third grade in California are English learners. So all of what we do, we must bring a lens to what is happening to English learners. Lori spoke earlier much more about evidence-based instruction in the classroom, science of reading. That's a big, important initiative for us at Families and Schools and trying to do some work statewide in terms of legislation. And it's so important to underscore the key practices for English learners and be more intentional about those practices that include oral language development, for example, not over-indexing on phonics, though phonics is critical, understanding some of the cultural relevancy of how we're teaching children, especially if they're in dual language programs. So it really, Swati, requires us to be very intentional. And in our work, and even in the movement around the science of reading, it has not been as intentional as it needs to be about those key practices when you're doing PD, for example, with teachers around the foundational skills, how children learn to read, evidence-based practices, to pay more attention to those needs of English learners. And in terms of chronic absence and some of the challenges that our families face that create more disparity, particularly around some of the achievement areas that we're interested in. We've got most of our families that have English learner students are growingly more refugee families that have fewer resources. And so there are going to be more barriers and challenges for their families that, again, we have to be more intentional about learning about and then addressing.
Thanks, Yoli. Catherine, can you come back on for we have just a brief bit of time. Well, you have the benefit of this incredible research trove on kits. Is there anything you'd like to add to this conversation around the equity lens?
Thank you, Swati. I mean, to echo what Yoli's saying, we need to think about the English language learners, and I think we need to think about how they learn. And then we also need to think about how we engage families. We've been able to work a process where we had bilingual, bicultural parents and educators join us, so that when we adapted our curriculum, we didn't just translate it. We had folks talk to us about what would be important for primarily Spanish speaking parents to know, and what helped the people we were talking with. And so really being intentional, as Yoli said, about listening to the parents and the educators themselves in terms of how you make these programs work, because the barriers will be different, the experiences will be different. There's never going to be a one size fits all. And we found that we have worked both with children in the foster care system, children who have early intervention, early childhood special education. Those are other families and other children and families who are impacted hugely by trauma or by needs for different kinds of education. And so again, really listening and making sure that you are meeting the needs of the people who you're working with, and not making assumptions about a model that should be one size fits all or supposed to be the best, is really critical in designing programs.
Thanks so much, Catherine. It's great to be reminded of the multiple populations that need our attention and focus. And I believe it's back over to you, Taniko.
Yeah, I think Taniko, thank you all so much for an amazing discussion. I think Taniko will share the slides again. And there should be a feedback form link that comes up there. Awesome. Obviously, this panel could have gone on much longer to cover many more relevant topics. We will do our best to address those questions, answer outstanding questions with some resources that we'll share. Some of those were dropped in the chat, and I'm sure we'll have a few more that will come up, and we'll share those all in the thank you email, follow-up email, which will go out by the end of this week to all of you who registered. And if you have colleagues that missed the session, they should receive that as well if they were registered for the series. We want to ensure these sessions and this series as a whole are meeting your needs. With that in mind, we're dropping a short feedback form into the chat. And then, as I said, there's a QR code on the screen. If you just want to pull out your phones and give us some feedback, we really appreciate it. We use your feedback to shape future sessions and series that the SEAC will hold. And we appreciate your feedback. And if you go to the next slide, we do have some upcoming opportunities. As we mentioned, this was the last learning series session in this series. Even though there's so much more to talk about, we scratched the surface here, but there's a lot more there. But we do have upcoming opportunities. Learning series 4, the SEAC will be hosting. We have another one, it's beginning in about a month, on serving historically marginalized populations. Those will be June 11th, June 18th, and June 25th. Those will all run from 1 to 2 o'clock p.m. Eastern Time. And please explore the SEAC website for additional resources on student and family engagement and strategies to address chronic absenteeism. That link should be in the chat as well, and we have a QR code on a later slide there. But stay tuned for invitations for that learning series. And thank you so much for participating in the session, in the series. We sincerely appreciate you taking the time to talk with us and peers during our session today and in the previous weeks. As a follow-up, as I mentioned, we will email a copy of the final resources, all of the resources that were dropped in the chat, as well as anything else that our speakers might have brought up on today's call. And if you are interested in sessions with the center and SMEs on a particular topic, you can email Taniko Reed or myself, or the SEAC team email address, whose contact information is all on the slide and should also be dropped into the chat. And then lastly, here is the QR code on the next slide for the SEAC website. If you want to learn more about the work that we do as SEAC, use the link or the QR code to find additional TA resources on our website. And thank you all so much. Thank you to our panelists and Swati, our moderator, for all of your information that you shared. And we look forward to seeing all of you at future SEAC opportunities. Thank you all so much.